Time now for the live coronavirus update for the city of San Antonio and Bexar County.
To 41,614 in our community since this began. Our 7-day rolling average now is 397, which is, again, going in the right direction. But, again, please stay vigilant. COVID-19 is still in our community, and if we keep up the mask wearing and physical distancing, we will avoid another spike in cases. It's critically important, especially as we get towards schools and Labor Day, that we get transmission down as low as we possibly can. That allows the testing and tracing and isolation to really be effective and for us to get a handle on this pandemic. So the bottom line is, don't fumble at the end zone. Our area hospitals have admitted now 68 new positive patients since yesterday. The average number of COVID hospital admissions over the previous 7 days is 71. So we're dropping a little bit in hospital admissions, and that is a good thing. We have 14 new deaths to report tonight, which brings a total to 394. That also is part of the log that we're coming down from the cases investigated from the state data. That includes 7 Hispanic males in their 30s, 40s, 60s, 70s, and 80s, 2 white males in their 70s and 80s, 1 black male in his 50s, and 4 Hispanic females in their 60s, 70s, and 80s. And please remember, again, want to emphasize that each of these people that we have lost is a neighbor, a loved one, a friend, a family member, a colleague, and keep them and their families in your prayers. Over in our hospitals tonight, we're reporting 817 people in the hospital, down 21 from yesterday. 345 are in the ICU, that's up 9 from yesterday, and 238 are on ventilators, up 4 from yesterday. 49% of our ventilators are available, as well as 13% of our staffed hospital beds, and our hospital system remains under severe stress. Let me turn it over now to Judge Nelson Wolff.
Yeah, thanks, Mayor. And the 340 that we're reporting today, COVID cases, that sort of backed up from yesterday and some light reporting from Sunday. So that number certainly does look better, and we are doing better in our hospital systems. We did verify that 24% of the COVID cases that are in the hospital come from outside of Bexar County. The STRAC region, I think region is about 22 counties. But we're also bringing in people from Laredo, as far away as Laredo. I think they brought in 11 of them from Laredo today. So that number is a pretty accurate number to be able to say. And our total hospitals were taken up with 35% with COVID patients. Now we're down to 21%. So those numbers do look better. But as the mayor says, we still got a long, long way to go to get back where we were before things came unhinged and the face mask was done away with. While we're doing good there, we're doing worse in the jail. We had brought down our COVID cases in the jail to 20, maybe 30 days or so ago. But each day is creeping up, and now we're 129 in the jail have COVID. And it's getting very, very frustrating as that number goes up because of what the state's done to us. 390 paper-made prisoners are ready to go to prison, but they're not taking them. We have 96 people that have been adjudicated and said they should go to state treatment beds. They're still sitting in the jail because they're not making the beds available. And we have 649 in the jail that would have been PR bond, personal recognizance bond, which carries responsibility with it, I might add. They're there because of what the governor did in changing the directions and overruling some of the judges. He did that order back on March the 29th. So we have 3,700 up in the jail, up 800 from where we were. We're having to put people in isolation units. You get tested, you have COVID, you go in that isolation unit. You come in, you stay 14 days in a different isolation unit till we make sure you don't have it. So what we're seeing is a really growing problem in the jail. We have 62 people, 62 guards and civilians out because of COVID, and it's costing the taxpayers $50,000 a day because of these actions by the state. So if you have any influence, and by the way, I did bring that up to the governor yesterday, and he made note of it, but wasn't giving any reassurance about anything. So if you got any influence with the governor of the state of Texas, you might want to say, hey, we're tired of paying $50,000 a day.
Thank you very much, Judge. And I also want to remind folks that even if your family is not one of those that has suffered the devastating impacts of COVID-19, staying home and physical distancing does, we know, have an impact on our mental health. So if you need help, please know that you're not alone. Don't hesitate to call Texas Health and Human Services 24/7 statewide mental health support line. It was created to help Texans experience anxiety, stress, and emotional challenges due to COVID-19. And so you can call 1-833-986-1919 if you need to speak to a counselor. That's 1-833-986-1919. Also, a reminder, tonight we'll be hosting a virtual town hall meeting regarding COVID-19 in schools with Dr. Junda Wu, who is the Bexar County Public Health Authority. The meeting will have live audience polling as well as opportunities to ask your questions, and you can be part of that conversation at 7 p.m. tonight on TVSA. As always, you can subscribe to the latest COVID-19 updates by texting COSA.gov to 55000 or visiting our website anytime at covid19.sanantonio.gov. Mario, myself, and the judge are available for questions.
Has there been an updated positivity rate for COVID-19 cases at the hospitals?
At the hospitals?
Bexar
So
County?
in general, we update the positivity rate on a weekly basis. The last one was 15%.
15%.
Which is a slow but steady decline, but still quite a ways off from where we need to be.
This briefing is continuing right now on KENS5.com and our Facebook page. There are 340 new cases tonight, bringing the total to 41,614. There are also 14 new deaths, the death toll at 394. A positive highlight, the mayor sharing hospital admissions are going down, but we are slightly up with patients in the ICU and patients on ventilators. The judge says as far as the jail and infections there, they began seeing a decrease in cases over the last several weeks, but the numbers are now going back up again.